I'm here to talk about the patient-driven protocol for the MediSize booster and when to use it and how to use it. More when than how. Basically, you can find this sheet in Section 8 of your training manual, and you'll notice across the top it says trace, watery, moderate, and tenacious, copious. What does that mean? Well, the definitions that we're talking about sputum, and our definitions for that are down on the bottom of the page. Now, when will we implement the T-piece and the booster depends on the viscosity of mucus. If a patient has trace, watery, or moderate secretions, I would say stay the course and either use the big blue and or the small blue. If a patient ends up in the tenuous, tenacious, and or copious area over here on the right-hand side, they're telling you they're running a relative humidity deficit, which means they need more than what our two devices, either or, can give them. So what may happen is they may have a patient come in and they have moderate secretions. The guy may get a bug, the guy or the gal, the patient may get a bug, and they may end up in the tenuous copious area. So basically that's when their viscosity of mucus is indicating what they need. So at that point, that's when you pull out your old trusty booster and T-piece, or they would. They would set the spike the bag of water. The water feed set would be hooked into the booster. We would put the booster into the T-piece. Remember that when you turn this on, it takes time for it to go to the green zone, which means it is at the optimal temperature to change the water into vapor. So it would look, as you remember, something like this. And this is not the easiest thing to do when you have to reach over this iPad. But anyway, this is what it looks like. If you go into Section 5 of your manual, there are two articles that talk about this chart. One is from the advanced article from Beaumont Hospital. Beaumont, and then the other one is from Sparrow. Both used to use Fisher-Paykel's 100% of the time on patients, irrespective of what was happening up here with the trace, watery, moderate, or tenacious copious. They were hell-bent on giving everybody Fisher-Paykel's. Anyway, after evaluating, they decided to go to this system here from MediSize. So you may want to look at those two articles again in Section 5, the advanced article and the Sparrow. The Sparrow was presented at the AARC by a guy by the name of John Reinbold, who is the adult lead therapist. Now remember, we're talking about adult systems here, not pediatric and not infant. So our focus is on the adult market. The little one can get down to a smaller tidal volume, and you got to be careful with that, that being 20 kilograms and up for this little one, the small blue. All right? If you need anything, give me a buzz, email. If you need any of this stuff sent electronically, ditto, same way, just contact me. Thanks for your attention. Bye.